Today in this video, I'm going to be talking about something that's super important to me, and that is volunteering at my local hospital as a teenager. So, if you're in high school and you're interested in pursuing a career in medicine or just helping out your community in general, then this video is for you. Okay, so first off, how did I get the position started? Like, how did I find out this is what I wanted to do? How did I get access to it? Okay, so here's how it went down. I've wanted to be a pediatric oncologist since I was like 10 years old, been knowing. So I was like, I need to get the experience. Like, I'm in high school now, like, time's going by, like I need to get some experience and find out if this is really what I want to do, like see if this is something that I'm still passionate about. I went, did a simple Google search. You should do a simple Google search. You're gonna find that there are going to be a lot of opportunities. A lot of them, though, be careful, are summer opportunities. They are summer programs, volunteer programs. You want something, personally, I think, unless it's an internship, what's best for you to do is find something that you can do year round that shows commitment, that shows time management, togetherness of your life. Like, it just shows that you're a well-rounded person and you get to build a lot of connections, which is something I'm going to talk about later on in the video. Once you do that, you're going to have to apply. So how does the application process work? For me, I had to write 2 essays. One of them was, why are you passionate about medicine? So all I did was basically write about how I've wanted to do it, like I said, since I was 10, why I feel like it's the best fit for me, how my personality fits into it, leadership opportunities and leadership positions I've taken up in the past and things like that. And then what I wrote next was, why is blank hospital the best fit for me? And for this, personally, I kind of took like the advice people give when you're like, why is this college best for me? You have to look up like information about them. Be like, I like the way you treat this group of patients with so-and-so disease, or I like this program. I like how you guys get the volunteers more involved, or I like the location. I like the size. I like the healthcare patient ratio. I don't know, like things like that. I basically focused more on how it was. The hospital that I currently volunteer at is a smaller hospital, so I kind of zoomed in on that, how it's a smaller hospital and how I'm going to get a better connection with the patients, and also the location, and how I read like about certain patients talking about their experience there, how personalized their experience was, how they have book cards, how they have the volunteers check up on the same patients again and again, just so the experience can be that much more personalized and that much more like you actually get to know the people that you're working with. Something I forgot to mention was the interview. I did have to get interviewed. The interview was a tour of the hospital pretty much, and he was like asking me questions during the tour. Something they're going to ask, and it might put you on the spot, but just make sure you have a well prepared answer, is how are you managing your time? Like, are you going to be able to commit to this? Are you going to be able to come once a week? Are you going to be able to come twice a week, or a few times a week, or every other week? Or how are you going to manage this with school, extracurriculars, sports? Besides that, though, interview was not bad at all. Something else that's super duper important to focus on is dress code, because that's how you present yourself to the hospital. That's how people are going to perceive you. And a lot of hospitals are very strict about their dress code and about volunteers who violate it. So at my hospital currently, I'm allowed to wear jeans and dress pants, no leggings, no sweatpants, no linen, nothing. But at another hospital that I was going to start volunteering at, they did accept jeans. They didn't accept jeans, but did accept leggings and sweatpants. So just make sure that you stay in touch with your hospital's regulations. And I think the best in between is jeggings, because they're comfortable, and a basic t-shirt with maybe a long sleeve under, because it can get really cold, and comfortable shoes, because you are going to be on your feet. So get some comfortable shoes. Okay, so now let's get into what I actually do while I'm volunteering. And I started off in a position that I'm not going to say I wasn't happy with. I was super ecstatic to be volunteering at a hospital. I started off as a wayfinder. So I was helping people to and from their appointments by wheelchair, without a wheelchair. I was bringing people to visit their relatives or family members who were staying at the hospital, telling people where to go, giving people directions, that kind of thing. But although it was great, because it was my first time ever volunteering at a hospital, it gave me a lot of experience. So don't be disappointed if you're like, oh, I'm gonna be at the front desk. Like, don't worry. Something I love about the hospital that I currently volunteer at is that they rotate you. So after a few weeks of working or months of working at a specific position, he's going to shift you to a higher level, more hands-on position, more medical like position, which is what I was looking for. After being a wayfinder, I was moved to the special care nursery, which was an amazing experience, although short-lived, because they actually cut down the program for teen volunteers. It was really, really great though to be able to do it. I organized all of the materials that they use, all the hospital materials. I got to see like the incubators, the newborn babies. If your hospital offers it, do it. It's a great, like, amazing experience. Please do it. I built relationships with the doctors, with the nurses, with like families. Like, it was great. And now I rotated to the endoscopy unit. So honestly, what I'm doing there depends on the day. Sometimes I'm bringing patients back and forth. Sometimes I'm helping patients out of the hospital. Sometimes I'm at the desk. Sometimes I'm giving news to family members. Like, it depends on the day. Like, sometimes I'm more hands-on, sometimes I'm more laid back, which is why like it's so important to be like dressed for like what you're doing. So make sure to keep in mind your dress code and talk to your volunteer administrator if you have one to get that down. But yeah, it's really important. Also, something that I'm going to mention, build relationships. You may be 16, 15, 17 in high school and you may think you're young so you can't do a lot, but make the most of what you can at your age. Like, if you're given a small position, do the best at your small position, because that's what's going to make you stand out. So make sure that you're doing the best that you can. Okay, so now I'm going to give you guys some final tips. First of all, be kind. Be kind to everyone, to the patients, to the staff, to the workers, everyone. Just be nice to them. You're a volunteer, you're trying to help out as much as you can. Just be very positive and be very nice to everyone. Second tip is make connections. Make connections with the doctors. You could potentially shadow them. You make connections with your volunteer administrator. Be very flexible with everything that's going on. Sometimes they're going to ask you to do things that may be out of your scope. It's going to be your first time doing a lot of the things they ask you to do. Be apt to learn. Just try your best to learn, and you're going to make mistakes. It's okay. It really is okay. Like, it's your first time, like we're like teenagers. It's fine. You're there to learn and they're there to teach you. So keep that in mind, and do your best and get comfortable shoes because you are going to be on your feet. Thank you guys so much for watching. I hope this was an informative video that answered your questions. If you still have questions for me, just ask them, let me know, and I'll answer as soon as I can. So yeah, thank you so much for watching.